Understanding cervical cancer risk. Cervical cancer is a significant health concern that many women may not fully understand. It's crucial to be aware of the risks and the steps you can take to protect yourself. What comes to mind when you hear the word cervical cancer? Fear? Uncertainty? These feelings are common, but knowledge can help alleviate them. Do you know that this disease, once a leading cause of cancer deaths among women, is now largely preventable and treatable, especially when detected early? Advances in medical science and increased awareness have made a significant impact. Cervical cancer affects the cervix, the lower part of the uterus that connects to the vagina. This area is crucial for reproductive health, and understanding its function can help in recognizing potential issues. It's a disease that can impact any woman, regardless of background. No matter your age, ethnicity, or lifestyle, cervical cancer does not discriminate. Understanding the risk factors and taking proactive steps can make all the difference. Regular screenings, such as pap smears and HPV vaccinations, are key preventive measures. This essay will equip you with essential knowledge about cervical cancer, guiding you through prevention, symptoms, treatment, and more. We will explore the latest research and recommendations from health professionals. We aim to empower you to take control of your health and make informed decisions. By staying informed and proactive, you can significantly reduce your risk and ensure a healthier future. Cervical cancer presents a significant global health challenge. According to the World Health Organization, it's the fourth most common cancer among women worldwide. In 2020 alone, an estimated 604,000 new cases were diagnosed, leading to over 340,000 deaths. These alarming figures underscore the urgent need for greater awareness and education. Many women remain unaware of the risks, symptoms, and available preventive measures. This lack of knowledge can have devastating consequences, as early detection plays a crucial role in successful treatment. By increasing awareness, we can empower women to prioritize their health, seek regular screenings, and access timely treatment if needed. The human papillomavirus, or HPV, stands as a central player in the narrative of cervical cancer. This virus, often shrouded in mystery and misunderstanding, is more common than many realize. It is a silent invader, often showing no symptoms, yet it has a profound impact on public health. This common virus, transmitted through skin-to-skin contact during sexual activity, infects most sexually active individuals at some point in their lives. Despite its prevalence, many remain unaware of their infection, as it can lie dormant for years. While most HPV infections clear up on their own, certain high-risk types, particularly HPV 16 and 18, can lead to cellular changes in the cervix, ultimately resulting in cancer. These high-risk strains are the true culprits behind the majority of cervical cancer cases. In fact, HPV infection is implicated in almost all cases of cervical cancer. This strong correlation underscores the importance of understanding and addressing HPV as a critical public health issue. Understanding the link between HPV and cervical cancer is paramount. It not only informs medical professionals, but also empowers individuals to take proactive steps in their healthcare. It enables us to appreciate the significance of vaccination and regular screenings as powerful tools in our fight against this disease. By promoting awareness and preventive measures, we can significantly reduce the incidence of cervical cancer and save countless lives. Thankfully, we are not defenseless against cervical cancer. Two primary weapons in our arsenal are HPV vaccination and regular cervical cancer screenings. The HPV vaccine, available for both males and females, targets the high-risk HPV types that cause most cervical cancers. Vaccination is most effective before the onset of sexual activity, but it can still provide benefits later in life. Cervical cancer screenings, such as the PAP test and HPV test, are designed to detect precancerous changes in the cervix. These tests are simple, quick, and can be life-saving. Section 5, early detection is key, recognizing the symptoms. While prevention is always preferable, recognizing the symptoms of cervical cancer is crucial for early detection and intervention. In the initial stages, cervical cancer often presents no noticeable symptoms. However, as the disease progresses, women may experience abnormal vaginal bleeding, such as bleeding between periods after intercourse or after menopause. Unusual vaginal discharge that may be watery, bloody, or foul-smelling. Pelvic pain or pain during intercourse. It's important to remember that these symptoms can also be caused by other conditions. However, experiencing any of these symptoms warrants prompt consultation with a healthcare professional. Section 6. Navigating treatment options and advancements. The treatment landscape for cervical cancer has evolved significantly, offering hope and improved outcomes for patients. Treatment options are tailored to the stage of the cancer, its size and location, and the patient's overall health. Surgery, radiation therapy, and chemotherapy are the mainstays of cervical cancer treatment. In recent years, targeted therapy and immunotherapy have emerged as promising options, particularly for advanced cases. Advances in medical technology and treatment protocols continue to improve survival rates and quality of life for women diagnosed with cervical cancer. Section 7. Stories of strength triumph over cervical cancer. Behind the statistics lie real stories of courage and resilience. Countless women have battled and overcome cervical cancer, emerging as beacons of hope for others. Take, for instance, the inspiring journey of Robin Roberts, the beloved co-anchor of Good Morning America. Diagnosed with cervical cancer in 2007, Roberts faced her diagnosis with unwavering strength and determination. She underwent successful treatment, becoming a vocal advocate for early detection and cancer awareness. Roberts' story, among many others, exemplifies the power of early detection, the importance of a positive outlook, and the unwavering spirit of those who have triumphed over cervical cancer. Section 8. Debunking the myths, facts about cervical cancer. In this section, we will explore some common misconceptions about cervical cancer and provide accurate information to help you understand the reality of this disease. Misinformation surrounding cervical cancer can fuel fear, prevent early detection, and deter women from seeking necessary care. It's crucial to separate fact from fiction to ensure that women are well informed and can take proactive steps towards their health. Let's address some prevalent myths and clarify the truths behind them. Understanding these myths and facts can make a significant difference in how we approach cervical cancer prevention and treatment. Myth: only women who are sexually active are at risk of cervical cancer. This is a common misconception that needs to be corrected. Fact: while HPV transmission primarily occurs through sexual contact, it's possible to contract HPV without intercourse. HPV, or human papillomavirus, is the primary cause of cervical cancer, but it can be transmitted in other ways, such as through skin-to-skin contact. Additionally, other factors can influence cervical cancer risk. These include smoking, having a weakened immune system, long-term use of birth control pills, and having multiple full-term pregnancies. Myth: cervical cancer always causes noticeable symptoms. Many people believe that if they don't have symptoms, they don't need to worry. Fact: early-stage cervical cancer often presents no symptoms. This is why regular screenings such as Pap smears and HPV tests are essential. They can detect changes in the cervix before cancer develops or in its early stages when treatment is most effective. Regular screenings are crucial for detection in the absence of noticeable signs. Women should follow their healthcare providers' recommendations for screening schedules to ensure early detection and better outcomes. Myth: a cervical cancer diagnosis is a death sentence. This myth can cause unnecessary fear and anxiety. Fact: when detected early, cervical cancer has a high cure rate. Advances in medical technology and treatment options have significantly improved the prognosis for cervical cancer patients. Advances in treatment have significantly improved outcomes for patients. Treatments such as surgery, radiation therapy, and chemotherapy are more effective than ever before, offering hope and recovery to many women. By dispelling these myths, we can empower women to prioritize their health and make informed decisions. Knowledge is power, and understanding the facts about cervical cancer can lead to better prevention, early detection, and successful treatment. Section 9. Your health, your priority. Take charge today. Cervical cancer is a global health concern, but it's a battle we can win. By understanding the risks, embracing prevention methods, recognizing the symptoms, and seeking timely treatment, we can dramatically reduce the burden of this disease. Remember, knowledge is power. Talk to your doctor about HPV vaccination and cervical cancer screenings. Educate yourself and your loved ones about this preventable and treatable cancer. Your health is your most valuable asset. Take charge today, and together let's strive for a future free from cervical cancer. Thanks for watching. If you enjoyed this video, hit the like button, share it with your friends, and don't forget to subscribe for more awesome content. Tap the notification bell so you never miss an update. Let me know your thoughts in the comments below, and I'll see you in the next one.